But if you use a brown amber or even kind of a yellow orange tint, it actually increases the contrast.
You mentioned tints. That's an interesting one. So how does that work? Is that something that a certain disease will have an issue that tints will help, or it's really just dependent on the person and how they see?
So it definitely has to do with the disease, although again, even within patients with the same disease can have different preferences. But depending on the disease, like glaucoma, is going to affect how we see light different than someone who has macular degeneration. So definitely in a low vision evaluation, you will definitely check on the tint that they prefer, more so to see how it enhances their vision, both reading, because I know we talked a lot about reading today, but also in the distance. So like for sunglasses, I'm not going to put someone who has issues with contrast, meaning issues with distinguishing the light and the dark in objects. I'm not going to put them in a dark gray sunglass because that's just going to diminish it that much further. But if you use a brown amber or even kind of a yellow orange tint, it actually increases the contrast and it makes it even easier to see targets in the distance.
Do you recommend tints a lot? Is that something that most patients will have benefit from?
I always discuss it, and it does make a big difference in some patients. And then, some people I try and they don't see a lick of difference. So it's really one of those things where at the evaluation, it's more about informing and showing people what is available and how things change. And it truly is, again, an individual process to see what actually helps the patient when we evaluate them.